Good morning, students. Myself, Jincy, lecturer from Emmanuel Etzer College of Pharmacy. Today, we are discussing about the topic monophasic liquid dosage form. Contents include introduction, classification of monophasic liquid dosage form, definitions and preparations of monophasic liquid dosage form. Introduction. Monophasic dosage form refers to liquid preparation containing two or more components in one phase system. It is represented by true solution. A true solution is a clear homogeneous mixture that is prepared by dissolving solute in a suitable solvent. The component of the solution which is present in a large quantity is known as solvent, whereas a component present in small quantity is termed as solute. Then advantages of semi-solid dosage form. It is easier to swallow, therefore easier for children and old age people. Facilitate absorption of drug faster than solid dosage form as drug is already in solution form. It is homogeneous, therefore give uniform dose than suspension or emulsion which need shaking. Simple and fast to formulate. It can be administered by various routes: oral, parenteral for injection, enema for rectal use, otic that is ear and nasal and ophthalmic preparation. And disadvantages of monophasic liquid dosage form. They are bulky, so difficult to transport and store. Water is commonly used vehicle which is prone to microbial growth, so addition of preservative is needed. When exposed to direct sunlight, it may undergo hydrolysis, so need to store in cool and dark place. Drug stability reduced by hydrolysis or oxidation, so they have shorter expire date than solid dosage form. Other major signs of drug instability are color change, precipitation, microbial growth, etc. Then classification for monophasic liquid dosage form. Two types of classification. First one is liquids meant for internal administration and liquids meant for external administration. Liquids meant for internal administration, there are classified into four types: syrups, mixtures, elixirs, and linctuses. Then, liquids meant for external administration of monophasic liquid dosage form. It's a classified into three types: liquids applied to the skin, liquids used in mouth, liquids instilled into body cavities. First one is liquids applied to the skin. It may be classified into four types: lotions, liniments, colloidons, and paints. Then liquid used in mouth, gargles, mouthwashes, and throat pains. Then liquids instilled into body cavities are classified into five: Dutches, eardrops, nasal drops, eye drops, and enemas. Then liquids mean for internal administration. Syrups, elixirs, linctuses. First one is syrup. Aqueous preparations of 60% to 85% sucrose with or without flavoring agents and medicinal substances. For example, chlorpheniramine, maleate syrup, or chloral hydrate. Then elixirs, clear, aromatic, sweetened hydroalcoholic solutions with or without medicinal substances intended for oral use. For example, dexamethasone elixir. Then linked uses viscous, liquid, and oral preparations that are generally prescribed for the relief of cough. For example, codeine linctus. Market available syrups and elixirs linked uses for examples are there. Then liquids mean for external administration. Liquids used in mouth, gargles, aqueous solutions containing antiseptics or antibiotics used to treat throat infections. Available in concentrated form with direction for dilution with warm water before use. For example, povidone iodine gargle mouthwashes. Aqueous solution with a pleasant taste and odor used to clean, deodorize the buccal cavity, have antiseptic and astringent activity. Example, antiseptics, phenol derivatives. Then throat pains, viscous liquid preparation used for mouth and throat infections. For example, phenol glycerin and compound iodine. Then markedly available gargles, mouthwashes and throat pain. The pictures are there. Liquids mean for external administration, liquids instilled into body cavity. For example, ear drops, nasal drops, and enemas. Then first one is eye drops. Sterile aqueous or oil solutions intended for instillation in eye. For example, timolol maleate eye drops. Then nasal drops, administered through the nose to obtain local effect, used during nasal congestion and upper respiratory tract problems. Example, oxymetazoline hydrochloride nasal drops. And then enemas, aqueous or oily solution that is introduced into the rectum and colon via the anus for cleansing, therapeutic or diagnostic purposes. Market available eye drops, nasal drops, and enemas. Pictures are there. Liquids mean for external administration. Liquids mean for skin. Liniments, lotions, and paints. First one is liniments, oil liquid preparations intended for external application with rubbing action to the affected area, used to relieve pain and stiffness such as from muscle spasm and arthritis. Then lotions, topical preparation with a low to medium viscosity, used to moisturize dry skin. For example, calamine lotion and baby lotion. Then paints, solutions used to sterilize the skin. Example, betadine antiseptic pain and magenta pain. Market available liniments, lotions, and paints. The examples are there. Then definitions and preparations of monophasic liquid dosage form. Preparation of gargles. Gargles. Gargles are aqueous solutions used to prevent or treat throat infections. They are usually available in concentrated form with direction for dilution with warm water before use. They are brought into intimate contact with the mucous membrane of the throat and are allowed to remain in contact with it for a few seconds before they are thrown out of the mouth. They are used to relieve soreness in mild throat infections. Phenol or thymol is generally present in small concentration for its antibacterial activity. Potassium chlorate is also included in gargles for its weak astringent effect to tone up their relaxed throat. It is also stimulates secretion of saliva which relieves dryness. For example, phenol gargles, potassium chloride and phenol gargles. Potassium chloride and phenol gargles preparation ingredients. Potassium chloride, patent blue, liquefied phenol, water sufficient to make. Dissolve the potassium chloride in warm water. Cool and add liquefied phenol. Add the dye solution, filter and make up the volume. Then preparation of mouthwashes. Mouthwashes, these are aqueous solutions with a pleasant taste and odor used to make a clean and deodorize the buccal cavity. Generally, they contain antibacterial agents, alcohol, glycerin, sweetening agents, and flavoring agents and coloring agents. Ingredients including sodium chloride mouthwashes, sodium chloride, sodium bicarbonate, peppermint water to produce 1000 ml. Then preparation of mouthwashes. Zinc sulfate and zinc chloride mouthwash. Uh, Ingredients required for zinc sulfate 20 gram, zinc chloride 10 gram, dilute hydrochloric acid 10 ml, compound tartrazine solution 10 ml, chloroform water to produce 1000 ml. Dissolve the zinc sulfate and zinc chloride in water. Add dilute hydrochloric acid to make a clear solution. Add compound tartrazine solution and add chloroform water to make the required volume. Preparation of elixir. Piperazine citrate elixir. Ingredients: piperazine citrate 180 gram, chloroform spirit 5 ml, glycerin 100 ml, syrup 500 ml, purified water sufficient to produce 1000 ml. Dissolve the citrate in a part of purified water. Add the orange oil, glycerin, syrup, chloroform spirit, and sufficient purified water to produce the required volume. Then phenobarbital elixir. Ingredients include phenobarbital 400 mg, alcohol 90% 40 ml, compound orange spirit 2.5 ml, glycerol 40.0 ml, amaranth solution 1.0 ml, and purified water sufficient to produce the 100 ml. Dissolve the phenobarbital in alcohol 90%. Add the compound orange spirit before adding the glycerol and amaranth solution. Add sufficient quantity of water to make the required volume. Then preparation of syrup. The syrups may be divided into two groups. Syrups prepared by simply solution or mixtures. For example, syrup ginger, syrup orange, and syrup lemon. Syrup sucrose, purified water. Ingredients include sucrose, purified water sufficient to produce. Then add sucrose to purified water and heat it to dissolve sucrose with occasional stirring. Then cool it and add more of purified water to make the final volume. Then ginger syrup, strong ginger tincture 50 ml, syrup sufficient to produce 1000 ml. Mix it. Syrups are made by process of extraction. Example, tall syrup. Tall syrup preparation, tall balsam, and sucrose, purified water sufficient to produce. Then add boiling purified water to the tall balsam contained in a tartar vessel. Cover the vessel lightly and boil the contents gently for half an hour, stirring frequently. Add purified water to adjust the specified weight. Cool, filter the solution and add sucrose. Heat on a water bath to dissolve the sucrose. Finally, the sufficient purified water to produce the required volume. Syrups are now used for vomiting, antibiotics, antihistaminics, sedatives, antitussives, vitamins, and bitter or saline drugs. In preparation of throat pain. Throat pains are viscous liquid preparations used for mouth and throat infections. Glycerin is commonly used as a base because, being viscous, it adheres to mucous membrane for a long period and it possesses a sweet taste. Iodine pain compound. Preparation ingredients include potassium iodide, iodine, alcohol, water, peppermint oil, glycerin to produce 1000 ml. Then preparation dissolve the potassium iodide in water, add the iodine and stir until completely dissolved. Dissolve peppermint oil in alcohol 90% in a small container and then transfer it into a iodine solution. Mix it well, add glycerin and mix thoroughly. Add more of glycerin to make the required volume. The preparation is to be stored in a cool place since iodine is volatile in nature. The preparation of lotion. Lotions are liquid preparations meant for external application without friction. They are applied direct to the skin with the help of some absorbent material such as cotton wool or gauze soaked in it. Lotions may be used for local action as cooling, soothing, or protective purposes. They are generally prescribed for antiseptic actions, for example, calamine lotion. Preparation ingredients include calamine, zinc oxide, bentonite, sodium citrate, liquefied phenol, glycerin, ingredients. In the preparation, rose water of commerce sufficient to produce 1000 ml. In preparation, dissolve sodium citrate in about 700 ml of rose water. Triturate the calamine, zinc oxide, bentonate with a solution of sodium citrate. Add the liquefied phenol and the glycerin. Add rose water in sufficient quantity to produce the required volume. Alcoholysis sometimes required include aqueous lotions for its cooling and soothing effect. For example, salicylic acid lotion. In salicylic acid and mercuric chloride lotion, acetone is used as vehicle. The preparation is used for scalp condition. For preparation, salicylic acid lotion. Ingredients include salicylic acid, castor oil, alcohol. Dissolve salicylic acid in 3 by 4th of volume of alcohol 90%. Add castor oil, add more of alcohol 90% to make final volume. Preparation of ear drops. These are solutions of drugs that are instilled into ear, the dropper. These are generally used for cleaning the ear, softening the wax, and for treating the mild infections. The solution is generally prepared in water, glycerin, propylene glycol, or dilute alcohol. However, vehicles like glycerin and propylene glycol are preferred. Sodium bicarbonate ear drops. Preparation ingredients include sodium bicarbonate, glycerin, purified water to produce 100 ml. Preparation dissolve sodium bicarbonate in water. Add glycerin and sufficient quantity of water to produce the required volume and make up the final volume. The airdrops should be having prepared recently. Then phenol airdrops ingredients include phenol, glycerin to produce 100 ml. Then preparation of nasal drops. These are solutions of drugs that are instilled in nose with a dropper. These are usually aqueous and not oily drops since they later inhibit the movement of cilia in the nasal mucosa and if used for long periods may reach the lungs and cause lipoid pneumonia. Nasal drops should be isotonic, have neutral pH and viscosity similar to nasal secretions by using methyl cellulose. Then preparation of nasal drops. Ingredients include ephedrine nasal drops preparation. Ephedrine hydrochloride, chlorobutol, sodium chloride, water to produce 1000 ml. Then preparation. Dissolve the ephedrine hydrochloride, chlorobutol and sodium chloride in water. Cool, filter it necessary. Add more water on filter to make the final volume. Then preparation of liniments. Liniments are liquids and semi-solid liquid preparations meant for application to the skin. Liniments are usually applied to the skin with friction and rubbing of the skin. Liniments may be alcoholic or oil solutions or emulsions. Alcohol helps in the penetration of medicaments into the skin and also increases its counter irritant or rubification action. Arachis oil is used in some liniments which spread more easily on skin. Soap is also included as ingredients in some of the liniments which helps in easy application of liniment on skin. Generally, liniment contain medicaments possessing analgesic, rubification, soothing, and counter-irritant or stimulating properties. A liniment should not be applied broken skin because it may cause excessive irritation. Preparation: a camphor liniment. Ingredients include camphor and arachis oil. Preparation: dissolve the camphor in the arachis oil in a closed vessel. Then ammoniated camphor liniment. Ingredients include camphor, eucalyptus oil, ammonia solution, alcohol. Dissolve the camphor and eucalyptus oil in 600 ml of alcohol, 90%. Add the ammonia solution with frequent shaking into it. Add sufficient alcohol, 90%, to produce the required volume. Thank you.